This is an interesting case. This is a patient with a detached glenoid fragment with an anterior labral tear and eventually remplissage as well. Initially on the MRI demonstrated a loose body, but inside you can see that a majority of the labrum is actually attached to this loose body. It's sort of a parrot beak tear similar to in the meniscus. Again, it's a little more unusual, and you can see if you remove that, there would be very little labrum left. This is a young quarterback who really needed all that labrum to try to keep the shoulder relocated after we completed the surgery. So we're going to use the new Arthrex labral kit. You can see here we're using a rotation lasso, and these fiber tacks are actually different colors. It allows for easier management. Again, the challenge with this is the fragment is in your face and moving around constantly, plus you have to get your orientation. We've already debrided the bone, and you can see we're passing this. Now again, you can see that the fragment's constantly twisting. The key here is not to damage the fragment or bone. You want it to get it to heal back, and this is a young patient. Hopefully this will do that. So you can see that we're trying to tuck it underneath the other part of the labrum. Again, it's hard to orient yourself sometimes in this. You need to be patient, and again, the key is multiple portals. So here we're going to this is going to really fix down that tail so it doesn't go back into the gutter. And you can see that we've removed no bone and we've removed none of the labrum. So now we're going to do a second pass. Again, usually 3 will hammock this in nicely. Again, you have to keep tucking this fragment in as it really has been displaced for a couple weeks and can be really challenging. We've also debrided that bone where you could see that was open cartilage had been pulled off, which is also attached to this fragment. So you can see here, if you remove that piece, you're really not going to have much labrum left. We're going to sequentially tighten the second one. Again, these are all knotless, and then we're going to come back and retension them in a minute. So now we're placing the third anchor, and then we're going to tension this down. Again, you can see that when we pass this with a rotation lasso, that fragment does displace. So you have to continually go back in as you're pulling down. Again, a nice thing about the knotless is that you have a free portal to use. So now we're going to pull this through, and you can see here that we're going to hold this while we are pulling and cinching down. You can see the 3 different colors, which is really nice with this kit. And you can see it still wants to curl back, so we're going to tuck it underneath the other part of the labrum. And sometimes you have to actually use 2 separate devices to push this under. You can see we're using both hands to tuck this down. Again, we've done 3, now we're going to do our 4th anchor. So once we've got it tucked nicely, then we're going to use the final knotless fiber tack. And I really, really like these anchors for this scenario. You can see that we pulled some capsule as well. Again, the goal is to make it look as normal as possible. You will pull some capsule occasionally in, but you can see how much more labrum bulk. You can see it's really nice here. We've done most of the remplissage, but again, you don't want to complete it till you've completed the labral repair. We've retensioned everything, and now what we're going to do is tension our knotless anchors, and you can see now we're pulling down the infraspinatus into the Hill-Sachs lesion. And here is now the completed anterior glenoid repair and labrum in addition to the remplissage. Thank you.